Like,
Oh, too funny. All right. So yeah, that basically for all of you, the updates are that Maine Prevention Network, there was an RFP put out for Maine Prevention Network for each public health district to have one provider of services for tobacco prevention, substance use prevention, and obesity prevention. And so ACAP put together a proposal for that, and we built into that some of the activities that were supported through that RFP through both, well, I think in all three of those domains actually were teen centers. So we basically took the youth proposal for a teen drop-in center and wrote it into that grant. And every time I had a question about something, I would run downstairs or contact one of the youth and say, okay, tell me what you want for, gaming systems. Tell me what you want for furniture. Tell me what you know. And so they provided input into all those different things. And we submitted that proposal on September 30th. We have not heard yet, but are hopeful. Some of the things that we wrote in, so it's an 18-month proposal, and we included 27,000 in rent, 53,000 for food. So that was snacks and a daily meal, a hot meal in the evening. 10,000 for furniture, games, that kind of stuff. Another $4,000 for like a promotional campaign, TikTok, YouTube, Spotify, and then phone, and they wanted like a Google Nest or a Ring doorbell or some sort of security system, Wi-Fi, those kinds of things. So so we wrote all of that in. Essentially, it came to about $100,000. Yeah, right around a little bit less than that for 18 months. We also included, so the tobacco prevention domain has this weird thing where you can add in a proposal for innovative programming, but don't add it to the overall budget because it depends on how much money they had. So you kind of add it as an addendum. It's but, so what we did for that was say, okay, well, the innovative part is that it would be youth implemented. Like, so we just kind of wrote in and said, okay, if you have money, throw us $5,000. We will let the youth advisory group determine what kind of innovative tobacco prevention programming they would like to see, and they can get proposals and they can determine which proposals they want to fund. So that is all, it's all pending, and fingers crossed. We also have in there our mobile service unit that we have been allocated funds through the congressional funding to purchase. And so the thought is that the youth advisory group would also be able to inform how that is used in different communities. And one thought is that it could be a mobile teen drop-in center. So, every couple of weeks it's in this Woodland, and every couple of weeks it's on, Thursdays on Mars Hill, or to get some of those outlying areas where they don't have much going on. And we also wrote in, and this was through the obesity prevention segment of programming, 1 trip a month transportation for a group of teens to go to an event. So like the dog sled races in Fort Kent, Maine Potato Blossom Festival in Fort Fairfield, Harvest Fest in Holton, whatever. So that essentially we're building community through the road trips. We're engaging young people to take advantage of opportunities right in Aroostook County. And, rather than planning separate freestanding events that are much more difficult to get people to go to, taking teams to where things are already happening. Pride Fest in June, all those different kinds of things. So those are it was written for 18 months, but then there are 4 renewals for 2 years. So if we're awarded, it would be basically 10 years through 2032. We would have that fund. We also wrote in a full-time position that the young people would hire, basically someone to then oversee and manage the teen center, the youth advisory group, to herd cats, as it were, and to stay on top of all of that thing, and to coordinate participation of Mayan conference as well. Assuming that would be a near peer, but it really would be up to the young people who they wanted to hire based on interviews. So that was all written and submitted by the 30th. And then if we get awarded that, we also work with the public health district, and Rachel, who's been part of our group, is the chair of that, so the coordinating council. So that will be another opportunity to pull in, some of this existing group and in the ongoing efforts to keep that going. Also, at the same time we were working on that proposal, Maine Youth Action Network was developing a proposal in response to a separate RFP, which was on positive youth development, engagement, and leadership services. Similar kind of thing, where it's an 18-month and then 2-year renewable 4 times, so through 2032. And Mayan accepted our proposal to serve as a subcontractor for, again, the teen center. So they kind of reorganized the way that they would do things, and instead of having regional based kind of subcontractors to provide all services sort of thing, they were going with about 3 direct funded youth-led initiatives. I think if I remember correctly, I think it was the Rainbow Ball, the Down East Teen Leadership Camp, or Acadia, whatever, somewhere coastal, and then our teen center. And for that one, they wrote in $20,000 for the teen center for this first 18 months. And they have already been provisionally awarded that. So that's the really good news, is that we have one more step toward the teen center. I am going, and Gwen is going to join me. She is the young person who goes to Fort Fairfield High School. We are going to go meet with mall leadership tomorrow afternoon and look at some different spaces. We've had one meeting with mall leadership and trying to negotiate a lease. And they are learning a lot about kind of how that works, what is allowable under a lease or not. They immediately started design work. So they did some 3D modeling, and they have paint swatches pinned up to their thought board, and they have a mood board that has all these different, ideas. And then we had a conversation with our development person who said, sometimes depending on the lease, you may not be able to do major construction. So they have, they want to change the flooring. They want to they're very much in nesting mode before we even have a place. So, but they also have a whole bunch of fundraising ideas, and are ready to do the work to make it happen, to make it possible. So that's all really exciting. And the other cool thing is that, we had these 4 youth over the summer. One of them got another job, but 3 of them are back. We have also begun, through the other work that we do with some teen programming, those 3 that we've had engaged will be doing a presentation at the Mayan conference at University of Maine at Orono, November 3rd and 4th. In addition to that, we've been working with Upward Bound, Trio programs, Carlton Project, and basically any other teams that we have been able to be in contact with. And right now we have 24 teams from Fort Kent to Holton that will be going with us to attend the Mayan conference. And we will have a captive audience during transportation to be able to really pick their brains and say, okay, like this is your leadership opportunity. Tell us what you want. Let's talk while we're riding. And so we'll have 2 overnights. They'll do the leadership conference, and we'll have through this CDC planning grant, because the youth advisory group is really a part of this proposal. We're able to cover transportation, hotel, and meals that are not already covered by the conference. So that gives us a pretty darn good start.
24 kids is a lot. That's great.
Yeah.
I don't remember that many coming from the county at previous conferences, so that's fantastic.
Yeah, I think 6 are from the Trio programs, and I want to say 9, maybe 8 or 9 are from Upward Bound. And so those are getting access to youth who have some risk factors, which is fabulous. And then we have a couple of young women from Fort Fairfield who went through our Breakthrough Youth program. And then I think there's 2 or 3 from Fort Kent. So yeah, kind of a little bit the whole length and breadth of the county.
It's exciting.
So these are all kids who don't know each other necessarily, right? Or youth who don't, which is kind of nice too, maybe to generate some cross-pollinate some ideas.
Yes, exactly. So they will know subsets will know each other. So part of our goal will be to break down some of those clicks and be able to say, okay, let's have those cross conversations.
Yeah, that's cool.
Have you done overnights at Mayan?
I haven't. I didn't get to go to last year's conference to my other staff members.
Are you going this year?
I am, yeah. In fact, our whole team, I think we have one person who's not going. The whole rest of our team is going. So we have 6 chaperones.
That's wonderful.
It's really fun.
It is fun.
The pool is a big attractor.
Some things never change.
Yeah.
Yeah,
There's
right.
a lot of talk about what's being served at the conference for food.
Food.
A lot of talk about being able to go to the pool. Yeah,
Sounds about right.
but it's really fun.
And I always slept between my boys and the door. I slept on the couch, pulled out. So there was this, they had to go around me to get to the door.
And Mayan staff sleeps in the hallway. I did. We all rotate shifts on who sleeps in the hallways. So
They give you a bed.
yeah, but we all would just alternate on doing duty to, monitor to make sure that young people were where they were supposed to be.
Yeah, but I meant a bed in the hall.
No,
No, you're hardcore on the floor.
just sitting outside of a door, just checking to make sure, because they never were where they were supposed to be. So
Well, and you're available as a resource should they need you at 3 a.m.
yeah, and inevitably they did. So
My father was notorious. He would often chaperone, whether it was band or athletics or whatever. And he would attempt to sleep in his room, but there would always be noise, and he was a pretty light sleeper. And he was a very hairy man. So he got a reputation for being a bear, because he would just come charging out of his room. And he would probably just be in his boxers. He'd have been arrested today, but he'd just be in his, boxers, and this big hairy dude walking out to yell really loudly and roar. make them go back in their rooms, because they didn't want to see any of that. but-
Shock them into compliance.
Yeah.
One way to do it. No, he didn't touch them. Okay.
Exactly.
So what do
I
you
just-
imagine? Oh, go ahead.
Oh, no, I just really want to applaud the teen center too. It's just, I keep hearing you talking about youth, listening to the youth, listening to the youth, listening to the youth. So I just so applaud the process and yeah, and all the modeling that will happen for others in community. Thank you for that.
I also have such a wonderful visual, Meg, of you running up and down asking questions. Like, what games would you like? And what kind of food are you interested in? That just creates such a like wonderful narrative for me about how you accumulated this information.
There was absolutely a whole lot of that. And it was constantly a dialogue. And Jamie was mostly the person who was here on site. The others were kind of either teleworking or whatever. So, hi, Erin.
Hi.
Sorry, I'm late. I had a doctor's appointment that ran over.
No worries.
Glad you made it.
Erin, this is Melissa from Mervyn. I'm not sure you folks have met.
I haven't. Nice to meet you.
No, nice to meet you.
The CDC with Sheila. Yeah. Yeah, I was just gonna say, we're talking about the kids and I'm thinking, and then there's Carol with her chip, right? She keep track of the kids.
The microchip.
Your
That's
microchip.
what we need for the youth at the conference.
Right.
Yeah, that's what I'm thinking.
Just have a.
The bell.
It just goes right here. Like it's small. They won't notice. Other than the installation, they will not notice. My cats have microchips. This turned into a story, Erin. So just never mind all of this silliness. Yeah. Well, we're recording this, so those who are unable to attend will hear the good news, sort of first/second hand. And I don't know, Meg, if you want to give a quick recap so Erin can hear what we've heard. Yeah.
The
Good news
short
twice
version
is
is that
news.
we were able to submit a grant proposal through the Maine Prevention Network RFP to include funding for the teen center. So we have submitted for that. We don't know yet. We're, fingers crossed. But we also know that Mayan has already been conditionally awarded their contract. And they included 20,000 for the first 18 months toward our teen center. So that's the really good news.
What is I don't know if what is the budget of the teen center? Like
Yeah, well, they don't really know. So they started working on it mostly because I started asking questions and I would say, okay, what do you want for furniture? And so they would kind of talk amongst themselves and then get back and say, well, we think this will work. And, what do you need on site for gaming systems? And what do you want for, and they kind of have their list of, okay, well, we need Wi-Fi and we need study, places for people to study, and we need this, that, and the other thing. We budgeted food, and some of those calculations we kind of came up with just based on our own use history and that kind of stuff. But so what we put into our proposal was pretty close to 100 grand over 18 months. And that included a full-time position to oversee and coordinate the youth advisory group and teen center and all the different youth focused activities. So, and that would be a position that the youth themselves would interview and hire. So, assuming that goes, and so basically for the accelerator plan, then when the whole section on sustainability and funding, like those are our funding strategies, right? So we'll write that in as this is the approach that we're taking. And then, as I mentioned, the youth have also developed a number of different fundraising ideas that they would like to pursue. We had to kind of rein that in a little bit. They wanted to start like immediately. And for one thing, we can't spend federal money on items that for a raffle, right? Can't do that. And then we also, after talking with our Sherry, our development director, she said, you might not want to go full scale. We have this thing that's happening at the mall till you have a lease. In part because then you're kind of committing yourself to that location, and then you might say, oh, well, we can jack up the price because they think. So they are learning a lot about contract negotiations and lease agreements and federal funding restrictions.
In action.
And the adults are going to learn from them as well. But yeah, it's cool.
Good.
So yeah, so those are the updates. We have the newest MIAS data. I am just desperately waiting, hoping for county specific data, because statewide is fine, but Aroostook is always different than the rest of the state. So really pitching to get that, so we can build that data and then use that as kind of one measurement tool. But I'd also be curious if folks have other ideas on things that could be built in. I mean, we'll be asking the youth as well, like, what would you want to measure? How will you know if this is a success and that kind of stuff? But if you have thoughts about that, that would be.
If you have a full-time position built in, that might be a really good place to be thinking about evaluation and metrics, is that having somebody on site about, just observational data and a useful thing to be considering as part of that person's role.
I shared yesterday that our Mattering initiative has 3 evaluations, and I had a conversation with Melissa today, who's our evaluator, does work, and we see an opportunity for 2 of the evaluation tools to be integrated if you're interested. So we could meet another time, Meg, I think, or we could bring it back to this committee, whatever. But I just, I think there's opportunity, and Melissa, you might, sorry about, you just took a bite, sorry.
No, that's okay. Sorry, it's snack time for me and Carol's cats, but yeah, there are some, we do have some evaluation tools that if you want, some quantitative as well as qualitative data that could be helpful. And we can do it on both sort of, well, we can do it on multiple levels, but sort of the partner level around like sort of how is ACAP's experience or whoever, but also the youth experience, and then sort of any adult experiences as well. So we can capture both qualitative and quantitative data that might be useful for further grants, or for again with the youth, if they want to look at the tool, learn how to implement some of that, do basic, I'm not a huge, I don't have advanced data analysis capability, but I can do certainly basic data analysis. So something like that with them too, if that is also an opportunity for them. But at multiple levels may be helpful as well.
Just thinking about resources too, Sheila offers a really wonderful presentation for young people and adults about data and statistics, and it is very accessible and excellent. And then Mayan, because as a result of running YPAR projects, has an, I would say, equally good offering for young people about how community research is conducted and how participatory action research can be done in a thoughtful and inclusive way. So just two thoughts about that too.
I don't know if this is the right time, so if not, we can keep going on some specific thread. I'm wondering how we envision the role of this group going forward. Like what, how are we thinking about the arc of the work and what people committed to for the short term versus what might be needed in the long term? Like, yeah. Does silence mean we have no idea? Because that would be fine.
From my perspective is when we're finished with this group, I mean, I think of our relationship with ACAP as ongoing and our added value. And I mean, this work came about with reaching out on Mattering and another social determinant, and a win of it is the teen center. So I just think that's a relationship or a conversation that I'll have with Meg at a different time. But yeah,
That's at the organizational level. I'm talking about the group level.
no, I was just saying when this ends is what I'm saying. I think Meg said maybe one more meeting is, but I take the lead from you. It's your grant, Meg.
I think when we did the mission statement, I'm trying to find it real quick. But I think when we initially talked about it, it was kind of like this, we were not necessarily thinking this would be another ongoing
Right.
sort of collaboration, but that once we had the plan in place, then it would be kind of time to step back or step up, depending on, the system. I guess I will say that if we get this award, we have 60 days within which to develop the work plan with I won't remember all the terminology. It's basically a needs assessment or a community survey of some such thing. And so what we were kind of thinking is that we wrote in for a facilitator to work with. So there are existing coalitions in the county that focus on substance use prevention. And then there's the Public Health Coordinating Council. And then the Youth Advisory Group. And so for those first couple of months to have a facilitator to equalize those voices sort of in the development of, okay, here's the work plan. Here's the gaps where we know they exist. Here's, the specific strategies that we're going to use to implement all these. And so I guess I could see maybe the invitation to this group, the folks who participated in this planning process, to maybe continue to be a part of those conversations initially, to kind of see whether they fit and they want to step up and say, yeah, I want to continue to be involved in this implementation work, or whether they step back and say, I think I've committed to all I can. It's been great. Go forth, do good.
Great.
Does that make sense? Because I feel like Kate, pretty confident they will continue to be active. We're constantly involved anyway through Pride and other collaborative efforts that we do on the regular. So Don Roberts, the non-drug free Rustic, has been, I expect that she will continue to participate in one way or another. And I think there's certainly opportunities for anybody else who's, for Damien, for others who might have been more recently integrated to continue if they want to. And maybe that involvement, like honestly, for Damien, I could see him running out of the teen center. I mean, so just depends on what level of activity and commitment people really want.
I think it's helpful to lay out the process that you just described. Sort of like opt-in, right? Gratitude and then opt-in, and opt-in with clarity of role and sort of time or whatever. I think would be really helpful to the group. Cool.
I'm curious if anyone has other questions or comments. I can kind of see like process from here. I'm assuming you'd like to read the final submission and that kind of stuff to have input into the final draft, but I also don't want to bore the heck out of people, so I'm not sure what the best way, but
Seems like sharing it, and then those who are interested can weigh in. Does that make sense? I think people will be curious and invested in understanding.
I think also an opportunity to thank the young people would be really, I would appreciate that. Just like some way to express gratitude for all the work that they've done, and also just to acknowledge everything that they've contributed.
I like that. Okay. Anything else for today? Any updates you want to share with one another? Anything shaking that everyone should know about? In addition to the Vermont Country Store catalog discussion, Erin, that you missed, we talked about cheese, pajamas.
I would have loved that conversation. I would have
Yeah.
rather done it than get blood done. So, or blood work.
Yeah. Well, sorry, that's what you missed.
I can send you your own copy. It's not too
Along
late.
along with the holiday nuts.
It's a
Which, of
really,
course,
it's a
is the
really
first-
good bag of nuts.
yeah, I was gonna say, which is the first thing I'm gonna Google when we are done.
It's the
Just
butter.
acknowledging.
It's the butter toffee peanuts, and it's not the small bag. I just want to be transparent with everyone. It is not a small bag of peanuts. It's a very large bag.
Most excellent. All right, well, maybe it's a wrap for today. Oh, sorry, Keeney.
Oh, no, today's October. Are we back November? Is that the plan? May? Yeah, okay.
yeah, I think that'll probably be our last one. I'm gonna try not to drag it out any more than we have to, in part because I kind of want to get it submitted with the funding plan that we have submitted, and not find out that we didn't get it and then we have no plan.
Well, good luck with
Also,
the prevention services application as well.
And that's the 15th from 3 to 5, right?
Yes.
Yeah.
Yeah, yeah.
I'm including it in the recording, which is why I said it out loud, just to be sure. One more opportunity to inform. Thank you, everyone.
Yeah, thanks.
I
Thanks
really
to
appreciate
you.
everybody's participation.
Thanks, Meg.
That whole
Yeah, thanks
process.
for all you do, Meg.
Good to see you guys.
Yeah, thanks. Nice to meet everyone.